Yeah, when I watch like a lot of webinars and stuff like that, it's like I get distracted sometimes, especially if it's like a 3 hour, 4 hour thing. And so what I do to keep myself occupied is I would write. I would write, take notes, and I find that works for me. If I write something down, and I have a tendency to do like acronyms, like do things to help me associate situation. Just say, for example, on your quiz that you had, if you try to imagine that you were this person that fell, what if especially falling on the wrists, that means that's an imbalance versus twisting your foot, there's something else. So you try to put yourself in the actual frame. So I do a lot of association to help me study. So that's why I'm asking, because most of you didn't do too well on the case study. And this is why I'm asking if if there's any questions you have, because we only have like about 5 or 6 more classes. Any questions? Miss Black, you need to show your video, please.
Excuse me, Miss Smith, I have a question.
Go ahead, Johnson.
Okay, why couldn't the assignment be sent as an assignment without the timer on it? I felt like it was very limited and didn't allow me to finish within a reasonable time frame.
Yeah, it wasn't an assignment, it was a case study. So there's homework assignment. That was not a homework assignment. That was a testing assignment. There's a difference between a homework assignment and a case study that's actually used for grades. One of the things is that that same question, Johnson, ask yourself a question. I really want you to answer this question. How prepared were you for the quiz? See, that's a question. How prepared were you? When you read the information about peripheral artery disease, how quickly could you have gone to that particular, if I, like right now, I have several folders in front of me. And if somebody says asthma, I know exactly which folder that's in. If somebody talks about acute respiratory, I know exactly where that's at. Because you know why? Because I've been in that folder, I've touched it, I've studied it, and I know what's in it. So the question then is, how prepared were you for that, for the quiz? Johnson?
I was prepared, but the time made me feel super rushed and like everything just ran out of my head. But I was prepared for it, but the time just kind of shocked me. So I didn't get to do what I'd like to do and write what I wanted to write.
Okay, so you see, and in this, you and then in the question that I'm asking is, you really have to be honest with yourself. Really, really have to be honest. I hear you say you were prepared. Okay, but you can also not be prepared, and it's okay not to be prepared, because if you're not prepared, that means it helps you to be better prepared for next time. Because if you say to yourself, oh, I was prepared, and I don't know what grade you got, Johnson, I'm just saying, but you got 50%, but it was the time. The first question that you answered, you would have gotten 100% on it, because the time was not of an essence at that time. You following me? The second question you answer, you would have gotten 100% on it, because time was not an essence. Now the third question, yes, because you're being rushed. And the first day, remember, there are certain questions have 1, 2, 3 questions in it. So the first question, you would got 100%. The second question in part 3, you would have got, but the third question might be blank. You see? So be honest with yourself, guys. How prepared were you? Because if you were 100% prepared, you would not get 0 and 1, 0 and 2, and 0 and 3. It just doesn't work that way. All right? If you are saying that I was not prepared, that means now that when you're about to do another case study or do another quiz, you would know what you need to do in order to be prepared. Now, a lot of your answers came off the internet. I can see it because I know my notes from internet notes. I know the textbook information from internet notes. So people just cutting and pasting and all those different stuff. And it doesn't work because discussion means discussion. That means I'm having a discussion now. Do I sound like a textbook to you? Do I sound like I'm reading from a textbook? No. I'm having a discussion, and that's how discussion is presented, as if you are free flowing and you understand what you're saying. But when you're writing from a textbook, it comes across very scripted. A second thing is in the question, one of the questions asks about clinical manifestations, and it spoke, the patient did not have diabetes, the patient didn't have kidney disease, but yet persons were talking about kidney disease and they were talking about diabetes. Anything else? I know I'm prompting the questions and I'm asking you to tell me what you would want to find out, because moving forward, we're moving into exams. Anything else? Okay, so here now tonight.
Before you continue, is it a way for us to review?
Yes, I opened it up.
Okay.
I opened it up about an hour ago. So just double check to make sure that you can see it.
Okay.
Okay. So I'm just going to share my screen for a moment. Instead of me, I knew that you guys were going to talk to me tonight, so I came prepared. Okay. So what I did here, can you see my screen with the three different columns?
Yes, ma'am.
Yes. Okay.
So I just checked and I don't see it open. It's still not permitting you to go into it.
Okay. If you look at the three screen columns here, this is the question about the pernicious anemia. It says, based on the findings, what lab levels or what other diagnostics should you include? So what I did is I just took 3 students' answers, and I'm just going to show you what to do and what not to do when you're answering the question. Okay. So this person answered, based on the finding, a blood test should be done. A blood test should be done. Now you see why that individual get it wrong, right? What blood tests? WBC, TSH, ESR, sedimentation. What blood test should be done? It didn't say anything. So when you are answering these questions, please be sure that you're looking at the question so you can answer it appropriately. The next person answered here, vitamin B12 serum levels, bone marrow examination. Which one of those should be correct? Which one should I mark right? Which one should I mark incorrect? So that means you guys didn't go over your questions then. So I'll use this as an example again. You're giving me 2 responses. I don't know which one to answer to mark. The third student said vitamin B12 serum level test. That's very clear, to the point. 1 response, 1 grade. Let's give that individual a pointer, a question, a point. The second question was, define the disease process that was described. The disease process that was described was pernicious anemia. So the first person here wrote vitamin deficiency anemia. Okay, the second person wrote pernicious anemia, and the third person wrote pernicious anemia. But what is missing here? This is how I taught you to do it. You write The disease is caused by with clinical manifestations of that's a blank, right? With clinical manifestations of, okay? You could also include predisposing factors if you want extra points. So let's look at this and this one here. Vitamin deficiency is a blank. That's missing. Is a what? Is it a disease, infectious disease? Is it a disorder? What is it? It is caused by lack of vitamins in the body. Which vitamins in the body? You have vitamin A, B, C, D, E. Which vitamins? And there's nothing here about the clinical manifestations. What is the clinical manifestation? So you can see why that individual would not get a point. Let's go, and furthermore, they said vitamin deficiency anemia. Okay, so pernicious anemia is, okay, is an autoimmune condition. Can we live with that? Caused by insufficient vitamin B12. Well, insufficient vitamin B12 is actually a clinical manifestation, right? If we look at this one here, her gastric mucosa does not have intrinsic factor, but that is what it is. But the individual in this sentence is not saying it is caused by the lack of intrinsic factor. We need to see that. What is causing it? And I'm not going to sit there to determine that because I know what the answer is. I need to know that you know what the answer is. That was in the first line. The second line said it is an autoimmune disease that affects the stomach. How does it affect the stomach? How? When we look at the third question is her treatment may include taking vitamin supplements daily. So once again, I'm going to take vitamin A, I'm going to take iron, I'm going to take vitamin B12. What am I taking daily? If you don't have any intrinsic factor in your stomach, how can you take vitamin B12? So that means it should be an IM injection. It should be IM. So even if you're looking at this, is taking vitamin supplements daily. What vitamins? And also eating a healthy diet. What is a healthy diet?
Hello, good night, Miss Smith.
Yes.
I put up absorption. That absorption, yeah, I put that absorption. That's what it did
one
not.
One of these is your response?
Mine is to the very last one.
If yours is the last one, then if yours is the last one, then absorption should be there.
See, absorption, lack of vitamin B12 absorption. That's what I mean when I say it couldn't function in the stomach. It's not good for.
Yeah, but that's what you mean. But that ain't what it's saying. That's you writing it out. You want to write it. I taught you how to write it like this.
Yeah, but
like
if you'd give a specific instruction for that, I would have done that.
No, I said that every time. As a matter of fact, let's go. As a matter of fact, I have it open up here. I have it open up in here. Okay. I have it open up here in this video. Okay. Basic pathophysiology. I will open this up here. I thought I had it open up. Did my screen switch over? Or do I need to press share again?
We can see it.
Okay. So when you go to this slide here, Mr. Ramming, I kept certain things I keep repeating over and over and over again. And I don't repeat myself because I'm a parrot. I repeat it for a reason. I keep talking about the inflammatory response system. I keep talking about oxygenation. I keep talking about glucose. And I say, how do you define a disease process? That's the only way I taught you to do it. So if I say to you, define pernicious anemia, define asthma, define COPD, define acute kidney, you have to start exactly like this every time. That's it. Because what you're doing is you're going all over the place and you're not making any sense with the response. So you can see from this response, you can see from this response here that 3 students gave 3 different things, and the 3 different things that wasn't making any sense, was not the correct response. So let's look at an example up here. So pernicious anemia is a rare blood disorder. That's what it is. It's a disorder. When you go back to that slide, this one here, let's go back to basic pathophysiology. Are we there? Can you see me here? I need to know if my screen switched.
Yes, ma'am.
Okay.
Yes.
When you go all the way here to the bottom of this, the disease process, right? There are 8 different types right here, either structural, right here. Taking a closer look at causes of the disease. Is pernicious anemia an infectious disease? Is the fracture an infectious disease? Is the peripheral artery disease infectious disease? Is it a neoplasm? Is it an immunologic disease? Is it a nutritional disease? Is it a metabolic, genetic, congenital, trauma? Of course, we know the fracture was a trauma. Okay, so you have to know how to classify it. Tonight, I'm not gonna be lecturing tonight. I'm just going over this part of it, and you guys are gonna go over your exam on your own to figure out what you did wrong, so you can be better prepared next time. This slide, you must open it. You must understand that there are 8 different classifications, 8 different ones. Once you determine that, what is it? It is an infectious disease. It is an autoimmune disease. Now, what is causing it? I'm going back to the other page. It is caused by an autoimmune process that makes a person unable to produce a substance in the stomach called intrinsic factor. So you specifically say what it is. This substance is needed to absorb vitamin B12 in the small intestines. And we know that vitamin B12 is essential for the development of red blood cells. So in that sentence, we've already covered that pernicious anemia is a blank and is caused by blank. Now we're going into what is the clinical manifestations. Symptoms of pernicious anemia may be fatigue, shortness of breath, rapid heartbeat, jaundice, etc. Hands and feet, diarrhea, and steadiness walking. Okay, when you go back into that case study, some of you had all sorts of things, leukemia, gastritis. If you were to write this the way I told you to write it, when you went to leukemia would not give you the symptoms that case study had. Gastritis would not have given you the symptoms that case study had. So you would know that you were wrong at that point. So the next question here is, her treatment may include taking vitamin supplements. Like I was starting to say, what vitamin supplements are you taking? A, B, C, D, E, what vitamin supplements? And what is a healthy diet, guys? I saw these words coming up a lot. What is healthy? Food, even if you wanted some points, you would say something like foods low in fat, okay? High in omegas. You want to increase your good cholesterol and decrease your bad cholesterol. That tells you what is healthy. What is proper? I see a lot of words like the patient has to be properly taught. What is properly? Remember, I'm reading this, and if I'm reading it, you're looking for points. If you're looking for points, you have to be explicit. So, answer, I am intramuscular B injection is what it is. High doses of B12 may be given orally, but it has to be high because of the lack of the intrinsic factor in the stomach. And it may take up to 6 to 12 months for the patient. Now, in this second response here, the individual says, the vitamin B12 will return to normal. Guys, listen, there is no intrinsic factor. So it's never going to return to normal. It may increase. It may increase. Read what you are writing, okay? This information came directly off of the internet. Vitamin B12 shots or pills. What is a shot? COVID shot? Pill? What are you talking about? It's an IM, specifically a Z track. You could write that down. Z as in zebra track. You guys should be learning about that in your pharmacology. Now, I saw somebody had their hands up. I guess it's not there anymore.
Miss Smith, sorry, that was me. I have another question.
Okay.
So what if somebody had the answers, but it wasn't written in the format that you say that you wanted it? You still marked it wrong?
No, if you answer the question, the results are already out. So you would see that you would get a point or you would not get a point. Now, in the 3 responses that I just showed you, there is no point in 1 and 2, but there are some points in 3. But there's no point in, I went over 1 a few minutes ago. 1, a blood test should be done. What blood test am I looking for? There's no point there. So I'm not looking for you to write it the way I wanted to write. I want you to write the response. Vitamin deficiency anemia, that's already the wrong disease process. But when you start to look at it, what you're looking for it is, what is it, what causes it, and what's the clinical manifestation? That's it. And then, of course, the treatment is to include taking vitamin supplements. What supplements? How can I give a point for that? So yes, I had to go over all of your responses. And if your responses is not correct, you will not get any what's it called again? Any points. Any other questions? Because I'm gonna go back. Somebody said they weren't able to open up the grades.
I make a comment, please.
Go ahead, Mr. Rame.
The comment I had was on his case study is a skill just to find out what the actual problem is. That's like the biggest thing with your mind thinking, because if you off, then you wrong on every single thing.
Absolutely.
So I feel as if we came this far, that's big, because if you hit all three diseases on point,
Mhm.
I think personally that's marvelous, because I mean, people is gonna miss at least 2 or 3 of them. So
I'm not following you though.
I don't know.
I'm not following you. I'm not following you. I hear, okay, in this response here, number 2, Let's look at that, right? This individual, if this individual had put, based on the finding, they had put vitamin B12 blood test, they would have gotten a point. Now going here, the vitamin deficiency anemia is incorrect. So therefore, nothing else could be right after that, right? So they get 3 points here, but they'll get 0 points here because nothing else could be right. It's just the wrong one. But here, her treatment should include taking vitamin B12 IM injections. Then you get your 5 points here. So out of this, you will get 8 points. You see, so you're not getting the entire thing wrong. You're getting marked for each one that you answer. Now here is where you go wrong here. This is why I'm focusing on this. When you look at the case study had clinical signs and symptoms in it. So if your vitamin deficiency anemia was not showing up as a symptom in my case study, then you know you had the wrong answer. That's why it is important for you to use these steps here to the right. That's why it's important for you to do that. Let's look at, I'm gonna go over to pathophysiology. Where is it? Okay, so I'm in Zoom, correct? You guys got to let me know because I don't know. Okay, so let's look at this here. It says 58-year-old Mr. Jones is 5 feet, 265 pounds. Tonight, I'm gonna leave you guys in a few minutes. Go and look at the BMI, what is the BMI of someone who is 5 feet 5 and 260? That means something there. That's not there just because I'm looking for words. Okay, this person is obese. What is his BMI? He reports he smoked 2 packs of cigarettes a day. What is the norm? Normal is to not smoke any. But what is considered a lot? Moderate, excessive. There is a number for that. Go on the computer and Google how many packs of cigarettes is considered aggressive per day. So now you're getting a picture of this man. Even though he smokes, he is smoking moderately. He's smoking aggressively. He has a noticeable mark on his leg. So noticeable mark on the leg is beginning of a symptom of something. He has pain while playing tennis. Okay? That means pain on movement. So you're going to write that down. So someone who's having pain on movement. He complains of fatigue and discomfort. So now we're looking for pain on movement, fatigue and discomfort. He further reports when he is sitting down, his feet becomes red and feels numb. That's another symptom. So now when you find out what this is, all of that information is going to be in the clinical signs and symptoms. His history includes being overweight. We see that already. And what is the total blood cholesterol level? What is that level? When we are done tonight, go and find out what is the normal level for total blood cholesterol. Find out what is the normal level for HDL. Find out what is the normal level for LDL. Okay? So once you know that, then you're going to say, what is high and what is low. So now, based on these symptoms, what do you expect this diagnosis to be? People had gastritis, leukemia, things that weren't even stuff that we didn't even discuss. All right. But the reason why they went wrong is because they didn't know what the normal values were. They didn't know whether this patient was high or low. They didn't know what the BMI was. So that is what's going to happen after class today. That's for you to do. Then you're going to define the diagnosis. Very simple. Once you find what the diagnosis is, it is an infectious disease. It is an autoimmune disease. It is a trauma. What is it? What causes it? And what is the clinical signs and symptoms? The clinical signs and symptoms right here in the case study. Right there. Now, explain. Don't go in the textbook and cut and paste something to me, because some people lose points right off of that. Discuss the predisposing factors. What is the predisposing factors in this case? All right. So those are the type of things that is expected. All right. So let me see if I could release this again. I thought I did earlier, and then you can tell me if you can see your grades. Case study assignment. Okay, let's try it now. Are you seeing it?
Yes, ma'am.
Okay, good. All right, so we're gonna end now. You're gonna go over your case study assignment. That is not for me. You don't have to send anything to me. You could go and watch TV. You could go and play with your kids. You could do whatever you want to do. But for the next hour and a half, I suggest that you go over each one of those questions. So what you're doing, you're creating, like I said, I can go into my portfolios now and I can find any disease process I want to find, because I know exactly what it is, where it is. Okay. So what was the response for the one with the guy with the legs? Anybody could tell me what disease process he had? I just went over it a few minutes ago. What did he have?
You say he had a peripheral artery disease.
Okay, and then remember now with arterial, you remember arteries feed and give oxygen to the toes. So because we have problems with blood going down, of course, his foot is going to be dark. It's going to be dark, okay? And he's going to have that numbness, okay, in the feet because it's arterial. When it's venous, venous deal with volume, blood volume. So if it was a venous problem, then he would have swelling. We spoke about that already. All right. We spoke about the treatment for PAD. That will be elevating the leg or keeping the leg in a downward position. Which one? Of course, it's oxygenated, so you need to keep it in a downward position. He has a problem with the foot being oxygenated. If it's venous, you have a problem with blood going back to the heart, so we need to keep the leg elevated, okay? So you're gonna go over that and you're gonna answer those questions for yourself, okay? So even now, for those persons who said they were well prepared, you're still not answering me about the questions, okay? So that means you need to go back and look at what you did not know, all right? A lot of people ask the question about the inflammatory process, all right? What the histamine does, what the prostaglandin does, okay? What does macrophage does? What is the role of the macrophage? That is what you should have discussed during the case number 1, 2, or 3. I don't know which one it fell into, but with the lady that broke her wrist. That assignment would be found on your, when we did the Nairport assignment, okay? So you need to go back and avail yourself of the inflammatory response, all right? So the PAD was on oxygenation. I told you that. The inflammatory response was on the wrist. And then the third question was on the pernicious anemia, which was on the blood, all right? So we sort of went over that already. But the other ones, you need to go over those yourself. You have the case study assignment that you're gonna review again for yourself. You're gonna go over the respiratory PowerPoints that is already uploaded there. And then you're gonna watch the pathophysiology of asthma. When we meet again on Monday, I'm gonna go over asthma and COPD, along with the disorders of the GI tract. You do have a midterm exam at 8 p.m. on Sunday. Okay? Any questions?
Do our lowest grade get dropped at the end of the term?
No, your lowest grade does not get dropped. But the reason being is because if I have students who are interactive and talking to me and trying, I can see that they're trying. Okay, I come on, I say, anybody have any questions? No one is answering. Okay. You know, and everybody's just sitting there and not saying anything. So how do I know what your lowest grade is? You know, I had to take out 3 people of the class already for not showing their face tonight. All right, because students come and you just hear. Okay, so if you are interactive, I can see that you're trying, then it's a possibility. But I don't know if you're trying. I don't know if you try it. I don't know anything. I don't know anything. So for now, I need you guys to go back. You have all night. There's no timer on you to go back and find out what you did wrong in those paper. Okay, what you're not following, and then re-look at the first PowerPoint slides that I gave you. I think is in a video format. Everything is in video here. Then once you would have done that, then you would go and you would attempt, oh, there is a case study in this respiratory PowerPoint, okay? So after you are done going over that case study and you start this respiratory, you're gonna find a case study in here and hopefully you can answer that case study. So we'll begin with that case study when we meet on Monday. I'll begin with that case study on Monday. So let me see if I can help you. Okay, if you come next week and you can answer and you're giving me all these off the wall responses, you're not responding, telling me what that disease process is and the pathophysiology, then let's see what happens. Okay.
Yeah, I cannot go back and see my case study assignment to review.
And somebody said they saw it.
I can see the grade, but I can't click review.
Okay, look at it now.
I can click review now.
Okay, good. Excellent. All right, good. All right. Any other questions before we leave? None. Okay, good. All right. So I'll see you guys on Tuesday. Oh, that's Ms. Black. Go ahead, Ms. Black.
At the beginning of class, I had an issue with my laptop camera, so I had to switch devices.
Okay,
So
no
that you-
problem. So you'll be able to pick up this. The recording should be up later on tonight because once I close off, it downloads and then I have to upload it on YouTube and then post it again.
Okay, thank you.
Mhm. But you got the assignment that you need to do for the next hour and 20 minutes, right?
Pardon?
You know about the assignment that you have to complete for the next hour and 20 minutes.
The case study?
Yes.
Right.
Yes.
Okay.
The review of the case study that you did on Sunday, and then you're going to go over the respiratory case study and the PowerPoint slides. Okay. All right. So I'll see you guys on Monday.
Yes, ma'am.
Okay, good.
Good night.
Good night.